Hi, my name is Therese, and I'm the author of this ebook. In 1992, I was diagnosed with bipolar disorder. I had been to doctors prior to that, but as I'll explain in this ebook, misdiagnosis is quite common initially. So I have a lot of information which I've researched and personal experience to share. The first section I go into is diagnosis and hospitalization, where I talk about how common it is to be misdiagnosed. And I also talk about what it's like and under what conditions you can be hospitalized, which has happened to me on more than once. You'll find out what it's like to be in the hospital. You'll find out what's expected of you, how long you're going to stay. You'll learn about involuntary commitment. And I'll talk about the patient's Bill of Rights, which is designed to protect you. The next section is the importance of being an active participant in your treatment. In other words, you can't just rely on what the doctor or the therapist tells you. It's important to educate yourself, which I have done over the years. I've researched my condition thoroughly as well as other conditions. I know all about the medications I'm taking and their side effects. And you can find that information on the internet, and I include links that you can go to learn about this. There's a lot of helpful information out there. I've also included PDFs from specific websites that have information that's useful for different diagnoses. The next section I go into is finding a psychiatrist or a therapist. I talk about the different ways you can find one. There's different types of therapy, and I talk about these different types. And if you know what these are, you can better choose a therapist. And one of the questions you need to ask yourself is what you want to get out of therapy, and I go into that as well. The next section is all about medication. I go into the different types of medication, their side effects, their interactions, and a little bit about their history. And the next section is affordable care. And this includes how you can get low-cost or free prescriptions. There's several places. And how you can get low-cost medical care from a doctor and how you can locate these doctors in the first place. I include links to websites which have a lot of good resources on them. Staying well. There's many elements that go into this, and they don't just include therapy or medication. This is where you really come into it, because you can take all the medication you want, you can talk to all the therapists you want, but unless you are an active participant, and this means taking care of yourself in basic ways like sleep, eating, and exercise, unless this happens, you're not going to lead a good life. The next section is something that really I didn't find any information about. I just had to wing it, and that's about disclosure. As you probably know, there's a stigma attached to having a mental illness, and even the most educated people will treat you differently if you tell them that you have major depression or an anxiety disorder or whatever. And I talk about how you should decide to tell friends, family, and more importantly, someone in the workplace. This is a really tricky area. Even though there are regulations in place to protect you, employers have ways to get around them. The last section I talk about is the subject of disability. There's a lot of information about there on how to apply for disability, but most of it comes from professionals, doctors, for example. People who, in other words, have never done it themselves. I currently receive disability. And I describe the whole process that I went through, share the information that I learned the hard way, and talk about additional ways in which you can receive help. At the very end, I have a list of websites, including pharmaceutical companies, and books that I've found helpful on the subject of mental illness. So check out the website, which is bipolardisorderliving.com, and there you can download the book. And as I say in this document, you can also leave a comment on the website if you have any questions, and I'll be happy to get back to you. Thank you.